Peterson, and I did the nursing rotation internship. And what I did is I pretty much audited AIDIT, isolation, and bedside reports. And there's a lot of factors that go into keeping a hospital running smoothly and successful. And the 3 areas I looked at, again, were isolation, AIDIT, and bedside reporting. And they're important because, once again, they make it run smoothly, and they're critical to St. Elizabeth's reputation and the views people have of it. And they're very important for successful healthcare delivery. Okay, isolation standards are a way to deter contamination and prevent the spread of diseases between rooms. For example, a lot of patients have MRSA, so if a nurse were to go into the room, get that contamination on them, they could potentially spread it to another patient. So that's a way to kind of prevent that. AIDIT is a form of communication from the nurse to the patient where it kind of just makes them happier, or pretty much as happy as they can be in the hospital, and keep them calm and just content with their status. And then nurse bedside reporting, that is what takes place between the change in nursing shifts. So each nurse, the existing nurse can pass on her knowledge and information to the new nurse coming on, and then the patient also can meet the new nurse and just be more comfortable with it. And the purpose of my project was to observe and evaluate these 3 areas. And my main kind of thing I looked at was if they were completed and what extent they were completed to. So, for example, sometimes people did half of what they were supposed to, but it wasn't all the way. So that is critical that they're all done correctly. And if they are done correctly, then St. Elizabeth gets a positive view. You got content patients and hopefully a positive health outcome. And if they're done incorrectly, there's a potential for a negative health outcome, a bad view of the hospital, and people just kind of not wanting to come back. So, some success factors that were critical was the opportunity through LPS and St. Elizabeth to have this internship, all of the highly skilled medical professionals that helped me along the way, and access to the hospital, its staff, and the patients. And the nurses all were very kind and willing to help kind of give me a new experience. And then those are just some fun facts about St. Elizabeth. Okay, and how I did it. What I did was I had 3 data sheets, one for AIDIT, one for bedside, and one for isolation. And the isolation was either a yes, they completed it, or no, they did not, and I will get into that a little more. But for bedside reporting and AIDIT, it was an 80% or above is considered passing. So if you completed 80% of the criteria, you passed, and if you did less, then it'd be a fail. So, and I recorded those on data sheets, and then kind of added up in a spreadsheet all of the people who did and didn't, and then I calculated the success rates. So AIDIT stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. And for acknowledge, it's kind of just being positive, keeping the patient at ease, and asking permission to enter. Introduce is introducing yourself and really talking yourself up, maybe saying, I've been here for 10 years, I'm a great nurse. And then duration is how long things are going to take, how long they think they're going to be in the hospital, etc. Explanation is the procedures they're planning for that day and why they're going to do them. And thank you, that's pretty simple, just saying thank you every time you leave. And bedside reporting. First thing one of the nurses should do when they're changing shifts is go and update the whiteboard. On the whiteboard you can change the date and the nurse's name, so any family coming in or even the patient knows what's going on and who they're going to be with that day. If family is present at the time, they should definitely be included and kept up to date. The patient should be included and just make sure they are understanding what they're discussing and how it's going. The pain score is discussed and any pain medications. And pain score is on 0 to 10 scale. and just 0 being none and 10 being like the worst possible. They are asked their chief complaint or any concerns they have that could be addressed during the day, the plan of the day and what the nurse knows the doctor will be planning or anything like that, and then asking the patient if they have any questions just to kind of clear things up. And then isolation. There's many things you could have to wear going in, but the most common are gloves and a gown, and if it's an airborne infectious disease, it could be a mask. And those are put on when you enter the room and taken off before you leave the room, so that contamination is always inside of the room. Okay, outcomes for isolation. And these are success rate percentages. Yes. So 86% of the nurses they passed the isolation. So they wore everything they were supposed to and just did great. The physical therapy and occupational therapy, I never once saw one of them go into an isolation room without anything on. They were very on top of that. And doctors, I never saw one put a gown on. So they got the gloves, but not the gown, which understandably they're not really hugging the patient, but still. So, and here's the graph for that, the 86, 0, and 100. And then for AIDIT, the outcomes. Okay, in Med-Onc, I was there for 2 days, and I shadowed one nurse each day, and both of those nurses passed every single room they'd go into every time. They were just nailing it on the AIDIT. In orthopedics, I was there 1 day, and I followed one nurse for about 2 hours, and she actually didn't get over 80% on any of her AIDIT responsibilities. And then in critical care, I was there 2 days, and I followed 5 or 6 people, just kind of jumping around and watching everybody so I could see as much as I could. And every single one of them, 100% nailed it. And I would like to point out, one of the best people who performed AIDIT was Clark. He was very, very kind to every single patient he went in the room with, and just went out of his way to make sure they knew that he cared about them and that he was going to take the best care he could of them. And then in progressive, I was there for 2 days, and I followed 2 people, and once again, just impeccable scores. And I'd say critical care and progressive were the highest, what I was the most impressed with when it came to AIDIT. They really did well. And then OB, I was there for 2 days, and I also followed 2 nurses, and they had a 75% success rate. One of the sheets was failed, so there was only 4 sheets. And then surgical, I was there 1 day, and that was 100% also. I followed Susie that day, and she would go into the room just to talk and make them feel good. So we actually, one man was telling us some war stories when he was in a German war camp during World War II, which was really interesting. So, and then that's the graph for that. So pretty good, I'd say. And then the outcomes for bedside reporting. In Med-Onc, once again, 100% did awesome. They made sure that patients were included. And I wanted to recognize Nikki on this because she asked the patients lots of questions and just made sure that all the bases were covered. Orthopedics followed one person for 1 day. Once again, not much communication with the patient, just kind of a simple, this is what's going on and out of there. Critical care and progressive both were amazing. It was cool to see what information transferred over because it's such extensive health kind of records of what had happened. I loved listening to that. And then surgical, once again, Susie made sure she knew everything. So, and the graphs for that. And then the lessons I learned. The staff at St. Elizabeth is amazing. Obviously, the percentages show that. They really try hard. The percentages were outstanding. I think that really also shows a lot about the hospital, that their nurses really care that much to keep their patients happy. And I was most impressed with critical care and progressive just because their levels of knowledge really stood out to me, and their willingness to show the patient how much they wanted to help them was amazing. And I could really tell the difference in patients when the nurses would use their aided tactics. At first I was kind of skeptical about it when Barb told me about it, but I can definitely tell. A patient is smiling at the end of the day, so, which I think is very critical. And then the team, this is a lot, and there's plenty more I could have fit on there. The nurses were amazing. They did everything they could do to help me out and just make sure I had the best experience possible and learn as much as I could too. And, okay, my experience. I did a lot. I was everywhere. I went to about every nursing department there is and just watched everything, and I loved it. My 3 favorite things to watch was I helped the man who was the war prisoner. We did an NG tube on him, which I got to watch and be right in on. And he took it like a champ, and that's how that came up. He said, "This is nothing." So, and then Clark, I was with Clark in critical care, and I watched a peritoneal. They take the fluid out kind of in your tummy pretty much and replace it and take the bad stuff out, and that was fun to watch. And then today was probably my best experience in the ER. It was pretty low until about 10:30, and they got a call from the ambulance and asked to talk to the doctor, and they had a man from the VA just across the street, the veterans clinic, that was having a heart attack, and he was a code, which means he was not breathing and had no heartbeat. And they were able to shock him and get his heart going, but they did have to intubate him, which means they put in a ventilator in the ambulance, and they brought him in, and I was able to follow into that and go into the cath lab kind of thing, and I had to stand behind the glass, of course, and I got to watch them start a femoral heart cath through his femur, or like his leg, and go up and find the blockage. I had an amazing time, and I will always cherish the memories that were made. And I would like to thank all the nurses that helped me, and Barb George, she helped a lot, along with Peggy, and it was just a great experience. And Emily and Paul and Dr. Ward, that was just an amazing experience, and LPS for giving me the chance. And then I'd also like to thank my grandma and my mom for coming today. So, yep.